incredibly critical topic to enable telehealth. So at this point, I will turn it over to Wes Kerr, who works for Connected Nation as our Director of Community Solutions, and he is going to moderate and facilitate our first panel of the day. Wes, take it away.
Thanks to everyone who's been able to join us today. I hope that you'll come away from our time today with some new ideas and some new thoughts on certainly, from our perspective, the broadband side of things, but certainly on telehealth and how these two things are, how heavily correlated they are, and the importance they have for all of our communities as we move forward. Today, I want to introduce our panelists, Sarah Tennant, Sector Development Director and Cyber Initiatives for the Michigan Economic Development Corporation. We have Barbara May, who is the General Manager for Agri Valley Services and Pigeon Telephone Company, Chris Kitchen, Enterprise Architect with Munson Healthcare, and Dr. Chris Ali, Associate Professor in Department of Media Studies and a Knight News Innovation Fellow at the Tao Center for Digital Journalism at Columbia University. Thank each of you for joining us today.
Thank you.
Thanks for having us.
Absolutely. For our audience, this is actually a fairly diverse group of folks. We've got folks, representing our broadband provider community, state agencies, the telehealth side, the implementation side, and certainly Dr. Ali, the policy and just kind of a more holistic response to broadband and its importance, particularly to telehealth and our rural communities. As we get into our discussion today, I'd like our audience to get to know you a little bit better and would ask each of you to give us a snippet of what your daily role at each of your respective organizations looks like and how broadband has changed your life in the last 12 months. Barbara, I see you're on, so I'll let you go ahead and start with that.
Thank you. Well, thank you for having me on your panel today. So as Wes introduced me, I'm the manager at Agri Valley Services and Pigeon Telephone. And my role there, of course, is to keep the broadband moving along as fast and efficient as we can. As you know, we're all in this together. We're all trying to do the best we can to close the digital divide. And COVID-19 definitely changed the way we operate. As soon as it hit, of course, it proved that broadband is definitely an essential. It's not a luxury anymore, it's a necessity. It changed the way all of us communicate. It changed the way we work. It changed the way our children learn. So as a broadband provider, we feel the pressure. And as a manager, I feel the pressure to get that rolled out to all the underserved areas that we can. In our general area here, I think we do a very good job at it. I know, having more than one provider in an area is also helpful, getting the gaps closed. So it's changed, and it's not going to go back. It's going to keep going forward. Technology is fast paced, and we feel it in the broadband industry.
Thank you, Barbara. Sarah, do you mind to respond there?
Sure. So my name is Sarah Tennant. I sit on the market development team within the MEDC, which is the economic development arm of state government in Michigan. Broadband, as the Lieutenant Governor said, broadband is really the enabling infrastructure for all the industry sectors that we look at within the MEDC. So the role of our team is to create and enhance long-term successful economic development collaborations that grow investment across Michigan, and having equitable access and affordable access and adoption to broadband, it underpins all of those goals. Our goal is to have great economic prosperity within the state, and we can't do that without the broadband infrastructure that is part of that. So how has it changed what I do? It's changed everything about what I've done in the last year. So my title says Cyber Initiatives, and we have focused a lot. Our team focuses a lot on new and emerging technologies and new industries. But broadband, because it underpins that, has been almost my primary focus for the last 9 months. Having only had a small investment in it, just increased the investments tremendously. It also has relegated me to this room for the last year. Instead of going around the world talking about Michigan and all the things we can do, we sit behind a screen. So it's changed the way we do things and the way I do things tremendously.
Thank you, Sarah. Dr. Ali, I'll give you a moment, please.
Yeah, hi everybody. My name is Christopher Alley, and like Wes said, I'm an associate professor in the Department of Media Studies at the University of Virginia. My day-to-day life is primarily teaching and conducting research. I am an expert on broadband policy and deployment. I have a book coming out on the topic called Farm Fresh Broadband, The Politics of Rural Connectivity, and that's going to be out September with MIT Press. And part of that was a large-scale policy analysis, trying to figure out how is it that we can, as a government, as a federal government, spend roughly $6 billion a year specifically on deployment, on infrastructure, and yet the digital divide hasn't shrunk. We're seeing larger divides, particularly around underconnected rural Americans. Part of this was also a 4,000-mile road trip across the United States called the Rural Broadband Road Trip I took with my hound dog Tuna, trying to get a firsthand experience about how consumers and providers and elected officials and people walking down the street were using broadband. During the pandemic, like everyone else on this panel, I mean, broadband is certainly, or my engagement with broadband has certainly changed. I mean, we're teaching on Zoom and have been since March of 2020. What became really apparent early on, though, was that many of my students were not connected equally. I ran a survey in the Department of Media Studies and found that upwards of 50% of our majors were worried about their broadband connections. And it meant a lot of on-the-fly changes. I couldn't do for one of my classes a live two-way conversation. We had to do an old school like AOL or ICQ chat session rather than talk in person or over Zoom. So it's definitely forced us to be much more dynamic, much more flexible, but also to remember this idea that there's a presumption of connectivity, right? Especially at elite schools, especially in higher ed schools, that everyone just has connectivity, and that is certainly not the case.
Thank you, and certainly last but not least, Chris.
Save the best for last. Thanks for having me today. My name is Chris Kitchen. I'm an enterprise information systems architect for Munson Healthcare, and my day-to-day is providing leadership to complex projects that Munson Healthcare has. Munson serves the 30 counties in northern lower Michigan, and I'm involved with leveraging technology and applications to enhance the delivery of healthcare. My background initially was as a respiratory therapist. So I come from a clinical background and moved into technology and kind of melding the two worlds together. But the past year, my life has been upended in many ways. I'm working from home and had to set up space and maybe provide incentive to remodel a little bit. It's also had my work focused almost exclusively for at least the first 10 months since the pandemic really hit Michigan of working exclusively on telehealth. Munson prior to the pandemic didn't really have a telehealth footprint. We were talking about it, we were planning for it, but we, in a matter of weeks, had to stand up a program so our patients, especially those with chronic conditions that need to be seen on a regular basis, were seen. So it's had a lot of impact on me from both a professional level and a personal level, not to mention I also started graduate school a few months ago. So I spend all my day on the computer and then go into the evening being a student. So yeah, I'm really relying on technology and the fact that I have good broadband.
We thank you all for joining us. And I know I've told a few of my colleagues that when we got together just to make sure everybody had the chance to get to know each other, that I had to call a timeout in the conversation because you all just took off with it, and so I'm excited that we get to have this conversation today around broadband and its in the relation with telehealth, and so to start off, and we touched on it just a little bit, but kind of holistically. I'm curious how you all have seen, and this is probably more for Barb to start with, but How big of a difference have you seen, or what are some of the changes that you've seen in the transformation of broadband over the past year with COVID-19 pandemic?
I think some of the biggest changes in the transformation is just getting it in people's hands and being, so it's affordable for them. There's a lot of pieces that we have to work through still, but we're getting there. There's a lot of challenges behind getting broadband out there. There's especially on the provider side, there's a lot of challenges that come behind that, but we're working through it. The stronger, the better we can get through it, the quicker we can get broadband in the hands of those that need it. But it's also, I think, worth noting that there is broadband in many areas. However, it becomes an affordability issue also. And we've seen that from, this pandemic has led that into our laps. And I know from a higher level, they're putting programs in place to help with those, the affordability, but that's a big piece. And also digital literacy is another piece. I mean, the more the broadband is being pushed into play, we still have to have those that understand how to use it, how to connect, how to get there. So a lot of challenges to overcome, but we'll work through them. Those are the transformations that I've seen just through this past year.
Chris, I'm gonna point to you, kind of following up with a couple of things that Barb mentioned. There is this, the idea of the literacy, and so I know you all stood up your program very quickly. How big of a role has the literacy side of that been in that, and what have you all done to help kind of bridge that gap?
Yeah, it's a good question. And as Barb was talking, I was thinking we haven't done enough to close that gap. In a survey of physicians, the COVID-19 Healthcare Coalition found that the top 3 barriers to patient accessing telehealth was access to technology, digital literacy, and then access to broadband and internet. So it's definitely one of the top 3 challenges we have. What we've done in our process is we develop materials for patients. I worked heavily with different resources on being able to have a handout to kind of walk through. I personally had called patients as a support person and worked with patients that really needed a visit. But that's not a sustainable model for us. And so we have a lot of challenges there. We did align with a partner for our telehealth program that does offer support to patients, so patients can call a number and walk them through. But the challenge of it is not only just overcoming the digital literacy, but all the lack of standards in digital technology. So even those that are literate have a huge challenge to kind of overcome some of the issues. And it creates challenges for us to be able to provide some type of support to help address that. But as I mentioned, as Barb was talking, I'm thinking, we need to make more partnerships in our communities to provide some type of support to patients to help them learn their devices, learn how to use telehealth. I mean, we chose a technology platform that was more of a text message. Initially, we had an app and we found patients really struggled with that. But my mom can respond and receive a text message, actually ad nauseum, she can do it. So, it's very helpful to kind of think about how are you getting this to them, and don't assume that an app is the easy way, or an iPhone or an Android phone is going to be the solution.
Dr. Ali, did you want to add to that?
Yeah, I think, I think one thing we've also learned about in the last year is how much not all internet access technologies are created the same, created equal, right? I think a number of Americans, when we started sheltering in place, sheltering at home, realized that they were underconnected, whereas maybe they thought beforehand they were fine. It was good enough. And now when we're asking everyone to go on Zoom, to have webinars, to work, to study, to shop, to communicate all from home, we're seeing a number of folks, again, particularly in rural areas, who may have at one point had broadband, realizing actually, you know, what I have is not technically broadband, and I can't do the things I am required to do in my everyday life. So I think we've definitely seen a shift in the types of high performance connectivity that Americans need and want to make sure that, you know, knock on wood, should a pandemic ever happen again, that they are equipped to be able to go forward and once again return to an online life if it ever comes to that again.
Yeah, and Sarah, to give you an opportunity to kind of chime in here a little bit, and Dr. Ali kind of leads us into this, is how would we define, or how would you even define, and we talk about it as a group here, but how would you define equitable connectivity, and how does equitable connectivity and telehealth services help a community?
So equitable activity is what everyone is saying. It's not just about the infrastructure, that's important, but it's also about having, you know, access to the programs, having access to the technology. So a smartphone just isn't going to cut it for the needs that we're asking our kids to do from a school standpoint. People can't work from a smartphone anymore, and that, I think, was what was considered, you know, connected for a point. They can't get on and get access to those types of programming or even things like unemployment. Those are things that you need a computer for, and you need to have good broadband for. So, and then they're all interconnected. So telehealth is a piece of it. And if we can get broadband out there for telehealth, it's going to help the family that maybe needs to work from home, and it's going to help the student that needs to learn from home. So the MEDC, in conjunction with Connect Michigan and the Lieutenant Governor's office, we created a task force this year to bring multiple state agencies together so that we can look at this holistically. The MEDC is not going to solve this divide by itself, but if we work with Department of Ed and Health and Human Services and MDOT and all of the other state agencies to understand what they're doing to create with their broadband access and then create their plans, we can do this together. It's not going to be a simple fix, and it's not going to be an inexpensive fix. So we need to understand from our perspective what we can be doing to help to bring these folks together to collaborate so that they will have access to telehealth, but also access to education and work. So we want people to be able to do all of the things together. And that digital literacy piece is imperative. We need people to feel comfortable with the technology so that they will engage in these types of activities.
You bring up an important part. You talk about the different partnerships essentially that are taking place, and certainly the work that's happening right now is important to that. But I think if we look at the pre-pandemic versus post-pandemic, kind of where we're living now, and I say post very lightly, recognizing that we're not out of the dark yet, right? But if we look at those two, kind of the pre and post or current, I think what we're seeing is the discussion, the partnership discussion has changed a lot. In the past, and Barb could speak to this, I'm sure, we had a broadband provider and communities, and I'll use that language loosely as well, because it could be a small municipal or an entire county or a region or a state would go to the broadband provider and say, what are you doing to give us broadband service? And Barbara and her counterparts are all sitting there going, everything we can. But there is so much going into this. Whereas now, this today is a good example. We're talking about telehealth and healthcare providers and schools and ISDs and our libraries and just private businesses, and all of these entities are now becoming a part of this partnership conversation, right? The healthcare systems are looking at it and going, we have assets or we have things that may pour into our ability to start closing this gap. What can we do and how do we go about this? And that was not a common conversation prior to the pandemic. School districts are doing the same thing. And so, Barb, have you had any conversations or are you, have you heard from some of your counterparts within other organizations where you're seeing some really unique types of partnerships where kind of non-traditional partners are coming into play now?
So let me answer it like this. The word partnership is very important to me. And I think it's very important. It should be important to all of us. And in helping bring this together. Do we have those conversations actively going on? Not always. Would I love to? Absolutely. I think, in all honesty, with where we're at in life today with broadband, it makes total sense to form a partnership, private, public, with your municipality, whomever, to get these going. You know, it's like sharing that road where someone's got an asset that they can help offload to the provider to get this to go through. It's all beneficial. I think we're in a time where it's important to form those partnerships. I would love to have those conversations more in our area. And, you know, some of it is what makes a partnership, what makes sense for both of us all the way around.
Yeah, you know, go ahead.
Wes, I was just going to say, for a healthcare system, I think it's essential to our survival of creating those partnerships. Not only do we have our own challenges as a health system covering 30 counties, but we also have competition from hospitals south of us that are coming into our market and offering services. And telehealth's just the start of it, right? You know, so the need for digital health and the opportunities there that you're going to see capital being infused into an investment, remote patient monitoring and digital therapeutics and diabetes management. I had my Apple Watch and I was showing my doctor that I was having palpitations and I was worried it was something to worry about. And, you know, more and more of that is going to become the norm. But for us, we've taken an approach, being a partner with Connected Michigan. We've reached out to local libraries for broadband access in the parking lot there. We're talking with other ISPs, you know, providers in our area. I think if we don't do it, we're going to be lost. Either competition is going to knock us out of there, or we're going to just grossly miss an opportunity with our patient population.
And if I could jump in here, Wes, to Chris's point, Connect Michigan is doing a great job. I feel, you know, they're working. I'm actually on 3 of their broadband committees here in our area. And they're doing a fantastic job at pulling the local together, the local government to the state level. And then, you know, it becomes listening. We have to listen to where the needs are of those people, and those partnerships in Connected Nation can help pull those, you know, needs out. But it's important.
Yeah,
You know,
I'll pile on that, because the MEDC really is looking to do that collaboration and convening in partnership with Connected Michigan, Nation Michigan, with our local economic development, with our community stakeholders, with our universities, with our businesses. Collaboration is the key to this, and it's not easy. Everyone says they want to collaborate until you ask them to collaborate, and then they don't want to collaborate anymore. So it's really rallying around the greater good and the greater cause that we're trying to achieve, recognizing that as we move forward, it's not going to be an easy process, but it's a necessary process. We have to get this right for our state. We need to make sure that people have access to the telemedicine. We need to make sure that if people want to stay and work in their communities, they can stay and work in their communities. So they don't have to leave to go somewhere else to work. That's, from an economic development standpoint, the sweet spot. We want to develop those high-tech, high-wage jobs. And if people want to stay in rural areas to do those jobs, we want them to be able to have the infrastructure and the access to do that.
You know, one of those, it's part of the mentality, that a shift of mentality that we've seen is that we're from a consumer internet service to it being very much the driver, economic driver. And Sarah, you and I have talked about that some. And so as we see more and more goods and services being provided through the technology of the internet, it becomes more and more important to all the different sectors, if you will, of our communities. And so, you know, Chris, you were mentioning it, you know, you all are in the northern lower, peninsula of the state. You're starting to see a shift from needing brick and mortar facilities in some instances to now this is the infrastructure, this, you know, the fiber or, you know, whatever technology is being utilized is the core infrastructure for delivering the product or providing the services that you all need to be able to provide. And we see that across so many different areas. And you know, Sarah, you mentioned those high-paying positions, and certainly we want to see that. But the internet begins to provide this new, I guess, a digital blue-collar position too, right? Where there's just general goods and services that we're going to see the bigger needs for as we transition to more digital, and those are great opportunities to replace some of these displaced positions that we see in rural communities. Dr. Ali, would you like to speak to that?
Yeah, a couple of things just immediately came to mind. One is back to this idea of digital inclusion and digital literacy. I mean, yes, we want everyone to be able to take advantage of the potentials of these new technologies, but it's not just about getting wires in the ground or strung up on poles. It is also about working with communities to work on skill development, to work on just kind of ease of access. I mean, again, I spend my life working with young people, and it's amazing. We think of them as digital natives, but a lot of times they don't even have the skills that we kind of assumed they would. So I think we're also seeing, organizations and institutions and individuals who did not think they were broadband stakeholders suddenly step up and take issue with their lack of connectivity and their lack of knowledge. Wes, you mentioned counties, and I'm doing a lot of work with Virginia counties right now, and almost all of them have broadband as a top policy priority. Many parlayed CARES Act funding for deployment or hotspots or Wi-Fi on school buses. And then we're also talking about the importance of local digital champions. I mean, these don't have to be paid positions. These are just people who are committed to connectivity in their community, and they can be rallying points for a lot of these really interesting partnerships. So, I'm thinking that the digital divide is going to take an all hands on deck approach, and COVID certainly introduced us to so many more stakeholders in this kind of ecosystem, which is so exciting.
Yeah, I like that idea. The work that we do, oftentimes we talk about a single point of contact for a community, just trying to streamline the process. I'm sure Barbara can confirm for us that sometimes there are communities that are not as easy to work with as others. And sometimes that's just, there's local policy and there's permitting issues and all these kinds of things.
Right.
And it's not as though there's one individual within that community that manages that. It's across 13 different departments, and we're talking, and sometimes these are small communities. And so being able to have that one person who can help navigate those questions really is, it's an important thing to be able to provide in a community. And like you said, it's a rallying point, right? It's that one individual who can help guide and direct what's happening and help in some instances, I guess, grease the skids to make things happen that might have taken 6 months, can be done in a handful of weeks when you have someone who's really concerned with it and paying attention to it. Barb, any comments there?
No.
So Wes, the genesis of how I kind of stepped into the broadband realm was I had some involvement before, but not nearly like I did this year. And what our team looked at, our market development team, we recognized that the pandemic was going to drive a lot of federal funds into the state of Michigan. So we were looking at those federal funds and realizing that our communities were going to be infused with funds, and broadband was a big part of that conversation. And that really was one of the drivers for this partnership with Connected Nation, was that we needed some technical assistance from a state standpoint to understand how we could best capture those funds in the state of Michigan to help to enable these technologies for our citizens. So, knowing that we would have that federal influx of funds, and that influx does not seem to be stopping. So, all it's done is amplified, and we know that there's going to be money coming down through an infrastructure plan. And how do we get our communities ready for that? How do we start bridging that digital divide? How do we start developing those plans? So that's really that's really the impetus for the MEDC to really get involved in this. We knew we had to do we needed to start. We had a plan. We are really good at convening. We're really good at, getting programs out there. So how do we start really looking at that broadband piece of it as well?
Wes, can I
yes,
say
please.
something to Sarah's comment about the funding? There is a lot of funding, federal funding, local funding. There's so much funding out there, but one of the things that comes behind the funding is it takes time to get that in our hands. The planning that goes into play, the engineering, the whole complete process from start to finish is not a timely process. But the big part is getting that funding in our hands. It's I know here in the Thumb, the one of the co-ops just recently was awarded some RDOF funding to build out. Well, that's great, but we won't see their build out this year. It takes time. So the funding is great, and we can all use it and take advantage of it, but there's challenges behind that also.
I agree, Barbara, completely. I think we have to manage expectations. Everyone wants it now and quickly, and with infrastructure build out, it doesn't always happen that way. So what can we be doing? What can we be doing in our agencies? And that's what we're looking at. What can we be putting in place so that when that infrastructure build does come into play, that we have people ready to, with boots on the ground? Is it looking at the supply chain? Is it looking at workforce issues? Those are all the types of things that we're trying to look at, so that when that build out happens, we can just hit the ground running. And in Michigan, we recognize there's some build out limitations because of weather. Sometimes we have to look at seasons and things like that. So the more that we can put into place prior to the funding, when people, a lot of times people look and they say, okay, what can you be doing? We're trying to do all the things that we can be doing that don't require funding, so that when the funding does come into play, that we can hit the ground running. But understanding that type of expectation management needs to happen as well.
Very much.
Yeah, and so we're talking about funding, and funding is obviously one of those barriers to being able to deploy, and we really haven't. There's so much funding right now, and it seems as though we're going to continue to see streams of dollars come along. And in fact, the kinds of the funds that are out there now, I think a year ago, most of us would have kind of laughed and just those are pipe dream kinds of numbers. And we're starting to see those funds, and I kind of pinch myself every once in a while when I hear some of the numbers that are thrown around for broadband deployment. And again, it just keeps, it's like the next day there's another tranche of funding going towards broadband. And so it's really important that we're coordinating. I think what I'm hearing for everybody is this idea of how we coordinate all of the work that's going on. How do we remove barriers so that when this funding does become available, we can use it in an effective and efficient manner and really get the best of what we can from those funds. And so with that, there's funding, but what are some of the other barriers? And I think you all touched on them. I heard some discussion of workforce. So workforce is absolutely going to be an issue. It's already recognized as an issue within the telecom world. Supply chain is undoubtedly going to be an issue. And so I'm curious from your all's perspective, how can coordination, and even at a local, state, or a federal level, how does that impact what we all hope to see is the closing of this gap over, say, the next 5 to 10 years?
I could jump in here because I'm thinking about, not only coordination, but who's supposed to be doing the coordinating. And, a lot of research has shown the importance of kind of a robust, well-funded, well-staffed state broadband office to act as kind of an information clearinghouse, specifically for communities and counties who are new to thinking about broadband, right? I work with a number of counties who are worried about they're asking what they think are stupid questions, about different technologies, or they know they need broadband, but they're not sure even what that means. State offices can play a tremendous role as kind of the super coordinator between these federal grant programs and on the ground deployment at the local level. And between there, we have states, which, I'd love to see every state have a robust, really great state broadband office and state broadband plan. It's not just about funneling money, it's also about funneling information and having conversations and dialogues, sharing best practices, right? Maybe it turns out that, one state in the Upper Peninsula or one county in the Upper Peninsula, figured out a way to deploy fiber in the middle of winter, right? There's different cement technologies you can use now. Sometimes these pieces of information get siloed away. And I think communities and counties could really benefit from some of this best practice sharing of what's going on in your home state.
Absolutely. I couldn't say it more. I mean, that's exactly what we're trying to accomplish. I think we had a roadmap in 2018, and we're trying to really operationalize what that looks like in the state. And really, COVID just amplified it. It ramped up all the efforts that we always knew it was important, but COVID just amplified everything. And that the digital literacy piece, that's definitely an obstacle, Wes. We've talked about that affordability. But really that digital literacy, understanding what we have for digital literacy in the state, who's already got programming, asset mapping, understanding what we do have in place so that we can just leverage some of the programs. Sometimes it's not about creating something new, it's leveraging what we have and understanding what we have. The schools are doing a really good job. They were thrust into this. Never before did we think we were going to have all of our students were learning remotely. And that's, that uncomfortableness, the positive side of all of this COVID and what's happened really is that people were forced to get comfortable with technologies in ways that they probably never thought they were going to have to do. My 80-year-old mother-in-law is watching, YouTube church service, and she's Zooming her family. I mean, what this pandemic has forced us to do is make people more comfortable with the technology that they may have never even thought about getting comfortable with.
Yeah, something interesting that jumps out to me is we do a lot under duress, and we make things happen. But long term, there's a lot we have to do. Just you could get broadband access to our service areas, but we still have to overcome lack of standards in some of the digital technology, right? And we mentioned digital literacy. We still have to see what long-term reimbursement looks like. The government's made a lot of changes in reimbursement that allows us. We've been willing, given the scenario, to tell patients, hey, go in the parking lot and have your video visit at a local library because they have 24/7 access. But if you're sitting next to someone talking on their phone in their car and they're on speakerphone, you can hear that conversation. And we're not thinking of privacy in that regard. In healthcare, privacy is all of it, right? What is the sustainability of some of what we're doing now? We have to think about from both a policy and process standpoint. And interoperability, as we use these technologies, how do we share that information with our other community partners in an appropriate way? When I think about, from a healthcare system, we focused on, well, what is the cost of implementation? What's the complexity? What is reimbursement? What's the disadvantages to face-to-face, and what other infrastructure do we need? One of the things we're struggling with in some of our areas and some of our practices is just patient preference. And we need to educate people, not only to get them literate with the technology, but to get them comfortable with using that technology. And I think, Sarah, you're talking about your, octogenarian mother, who's doing all this other stuff. My concern is what message are we sending, right? Effective communication is really important in healthcare in particular, because the patient lacks power and control. And so active listening plays a big role, and it's hard to be an active listener through video technology, right? I can be looking at the electronic medical record, looking at the patient's labs and data, and in the office, and kind of lean towards them, and my nonverbal body language, right, is telling them I'm listening and I'm interested in what they're saying. If I spend my video visit now where I'm two-dimensional, I don't like that view. The problem is the patient's thinking I'm disengaged and I'm not paying attention, and they don't matter to me. And that's really, really important in shared decision making. So there's a lot we have to do around this, and healthcare is just one example. Education has its whole other list of issues that it has to overcome, some of which are shared by these. So I think the more we talk about it, the more we think about education and public policy and incentives and other things will help get us there. But we have a long way to go. We've accomplished a lot, and we're not putting the toothpaste back into the tube at this point. But we have to get with it quickly, otherwise we're going to lose.
Yeah, don't get me wrong, Chris. I can't wait to meet in person, and I can't wait till we can start having these conversations in person. There's a lot of things you can do by Zoom, but I miss people. I miss having those, those conversations. I think it's about giving people the option, though. It's looking at it all in a different way. So if I can do a telehealth visit, and that's the right way to do things, or you have to have that. It's great to have that option. But if I want to go see my provider, I have that option as well.
And I'm with you there. I'm not arguing against it. I'm really arguing with it. But we have to make sure people are trained to use this technology.
Absolutely.
On the provider side, right? Because we don't think about our nonverbal communication and what active listening does to that patient, and the power balance. And it's also about, the cues that manage, who has the floor and taking turns when you're communicating with each other. So I'm with you, but I think we're going to just see that this just opens up the door, because we proved, for me, the hospital has never thought about having us work remote. We've done it with a few people out of necessity. Now my CIO is like, well, we just proved for the last year that we can do it really effectively, and maybe even better than we were doing it before. So, a lot of things to consider here.
Chris, I think to your comment also, or adding to that, I mean, telemedicine or telehealth is definitely on the rise. I just had my first experience here a week ago. It was interesting. But, looking at it in a bigger, broader perspective, bringing telehealth into a community where maybe you have someone that can't get out to that doctor, can't drive, a low income, or whatever that challenged case may be. I think telehealth is going to be a good option going forward. I do agree with your points, the educational process of it, the confidentiality piece, but I think it'll be a good thing.
Absolutely.
Mm-hmm.
Yeah, I think both the important thing and potentially the vexing thing, though, is that, Chris, you mentioned telehealth, you mentioned education, there's economic development issues, and none of this can be zero-sum games. We have to do it all, which I think makes it all the more important to have conversations like these and sharing best practices, because I think communities know the importance of broadband plus everything else, broadband plus digital inclusion. But it can definitely be overwhelming. And Wesley said there's going to be a lot of money coming down the pipes. So I think this is, important for communities or counties, neighborhoods to have broadband plans in place to figure out, okay, what are we going to do first? But also knowing, well, it's not that just because we're focusing on the school doesn't mean we don't care about telehealth. And I think that kind of juggling act is going to be a unique challenge for local communities and counties.
Yeah, that's it's why it's so important to assess all areas in a community. And so when you do that, you have a better understanding of who's doing what, why are you doing it this way? What do you, it used to be, what do you want to do? And now it's, what do you have to do with this, right? And so now being able to look at that across all of those different areas, we call them sectors, and recognizing that there is a collective need that exists here, and how can we rally around that? Because as we talked about partnerships earlier, or collaboration, everybody wants to collaborate until nobody wants to collaborate, right? Until it's time. And now it's, when we talk about trying to bring all of these resources together, I mean, at the end of the day, that's what we're talking about is how do we, combine the collective resources of each of these different areas and needs, so that we can attain what really is necessary. And so, we talked about an option of telemedicine or telehealth in rural areas. If we don't get the broadband networks there that are needed, there's not an option. There's just not there's no connection at all, right? I don't have the opportunity to see that doctor who is, and don't get me wrong, telehealth has lots of other issues that we're going to come back to soon enough when we do have better connections and the pandemic kind of settles in a little bit. But, if I need to see a specialist who isn't, not even 200 or 300 miles away, but maybe 1,000 miles away, all of a sudden we at least have the infrastructure soon enough to help make that a possibility. And those aren't even possibilities right now, right? I have to pack my family up and travel that 1,000 miles to go see that specialist for what may end up being a 45-minute, consultation that could have been done quite literally sitting in a bedroom at home. And so there's a couple of questions that have popped up that kind of look at this. And the idea that rural libraries are an important part of telehealth equation, it couldn't be more true. So many of the libraries in the past year I think have been reinvigorated, right? We found this whole new need for the services they offer, even if it has been they're a gateway to broadband access. And so seeing the libraries really take that role, I think is important. And as we kind of look to the future, as we try to close the gap for all households and everyone, I think we need to be very mindful of what can we do to continue to assist and grow our libraries networks so that they can continue to support those folks, because we will always have individuals who do not have access for whatever reason. And can we, how do we solve that problem? And libraries are absolutely one of the big parts of that. And then the other question just being this idea, and Chris, I know you're probably thinking about it a lot, is when we do get beyond the pandemic and we start to, some of this, as it was said earlier, the toothpaste isn't going back in, right? Some of this is not going back to the way that it was before, but we are going to have to stop and reflect on what we have done and what did work and what doesn't work. And I think those things will definitely have an impact on how we build networks, how aggressively things are done. And I know that you all are already asking those questions. When we did that over a 30-day time frame, did we do it right? Do we have to make changes? Did we leave vulnerabilities out there that we can't accept? And are there regulations that may come back into play that slow some of that down? So I think those are things that while they're very telehealth or telemedicine kind of focused, they will have huge impacts on how we, again, deploy networks and how we collectively work and cooperate with one another to ensure that the types of services are out there that are needed. Barbara, a couple of questions here, I think, in this conversation is, how do you all, and I say, I don't want to put your organization necessarily on the spot, but just broadband providers in general, do you see having, those conversations with, say, healthcare providers to expand networks? Are those things that you think you're seeing more of, or you would be, interested in? Because again, Chris is sitting there looking at, how do I reach all of our various different locations, or how do I expand into maybe new towns or communities that they don't already serve? Is that something that you're seeing more of, and that, and how would you want those conversations to take place?
So I can't honestly say that I'm seeing more of that. I'm not going to say that it's not taking place, but just in my personal experience, I don't see it. Now, we do provide, there's 4 hospitals here in our area that we work with very closely, providing broadband, and they have their, of course, telehealth programs. So we do work closely with some here, but by all means, on a bigger scale, absolutely, it's important.
And I think, Wes, when we talk about this, whether it's telehealth or education or work, it's all interconnected. If we can solve that broader problem, we're going to be solving multiple problems. We're going to be solving the problem of kids working, educating themselves from home, people who want to work from home or find jobs where they can work from home. We don't want kids at a Taco Bell accessing internet unless they want to be at a Taco Bell accessing internet. It's yummy, but we don't want them to be there unless they want to be there doing that. We want to, they need to have options for at home and work. There's a lot of jobs out there that we have discovered can be done remotely. And this is a game changer. It's a game changer on economic development. What is this going to look like moving forward? Michigan is a very desirable place to live. We have a lot of recreation. We have a lot of, people who want to be here, but maybe they weren't able to work. Their job didn't afford it because they had to be in a building. How do we start drawing that talent into the state? Because we do have this connectivity, or we do have these services. We want to be able to grow that within our state as well. But if we can, it's like, if you can solve the one problem, you're solving multiple problems, which is fantastic. But it's going to take a lot of people to do that.
You're right. We living in Traverse City, right? A lot of people want to be here, and there are people moving here because they have the opportunity. Likewise, Michigan could see some more exodus in the winter with younger people now going to Florida. I mean, I'm thinking about it going, boy, I could, leave for January. So it has bigger implications too, as you think about the changing world. So one, you have to have the broadband access just to stay competitive, right? And keep people and attract people. But two, we also have to realize that, we're all going to change our mindset, and the old rules of the old economy don't apply, perhaps.
I think one of the really interesting industries to look at is actually real estate. We see a lot of people wanting to leave cities and live in rural communities, especially during the pandemic, and suddenly realizing they bought this house and didn't even think about asking if the house was connected. We certainly see this a lot in terms of rural Virginia. My husband is a realtor, and he said he has this line, it's not location, location, location anymore, it's location, location, broadband. And people are having problems selling homes who are underconnected, and people are having problems buying homes when they want that kind of urban style connectivity that just isn't there in so many parts of rural states, including Virginia.
That's a true point, Dr. Ali. We get that question often. So, and COVID definitely transitioned a lot of people into our area. And that's one of the major questions, is there broadband there? So it's a big deal.
Dr. Ali, there was a question that came in, and I think it was specific to you. And so I'm gonna go ahead and throw it out there. What do we need to do to maximize opportunities for success in broadband deployment in rural America with the various programs that were recently funded?
I mean, that's a great question, Heather. Thank you. There is as Wes said, a tremendous amount of money coming down the pipeline, both for affordability, for schools and libraries, and then the potential of $100 billion in this new infrastructure plan. Just as a little bit of history background here, in 2017, the FCC said it would cost $80 billion to connect this country with 100% fiber to the home. That's probably an under exaggeration. I don't know if that's a conservative estimate, let's say. So, but there is going to be a tremendous amount of money. I think one of the things that we can really think about is look at the state level, who is our state incentivizing to be providers? Does the state have restrictions against cooperatives, for instance? Does the state have restrictions against counties or municipalities offering broadband, or offering financial incentives to partner with a broadband provider? And those are, some key battles that still need to be fought to make sure that we can get this kind of all hands on deck approach. Certainly Congress has woken up to the fact that they need to start putting some big money where their mouth is, because Sarah, I think you said it too. I mean, if we try and piecemeal this again, and I say again because we tried this during the Recovery Act and we didn't put enough congressional money in there, it's not going to work. Rural communities are going to fall further behind. So we can talk to our county boards, we can talk to our state representatives, we can talk to our national, federal, congressional representatives as well. The FCC just released a broadband mapping tool that we can start actually logging our broadband speeds. And when our provider says you're paying for 400, 100, and turns out you get 100 down, 10 up, we are being more empowered. We as consumers are being more empowered to challenge kind of some faulty advertising, faulty reporting here. So I think there's a lot of tools that we can use. Hopefully a consumer's toolkit will exist soon. That we, I know Next Century Cities has a good toolkit. Internet Society certainly has good toolkits for what communities can do and individuals can do to make sure that their elected representatives know the importance of broadband. And particularly if you're in an underconnected area, which may be technically served, right? Which we know the problem with mapping these days. So I think there's a lot of exciting things to be excited about from the level of the consumer about, maybe empowering us a little bit more to take hold of our digital futures, so to speak.
There was I guess a question or a comment dropped in the question box, but they make mention of the fact that they're working with members of the disability community who are very interested in new jobs that are available that can be done online from home now. And, so expanding and improving internet service will serve many different purposes. And this is an exciting area where jobs that, Sarah, I think you said it earlier, we learned in the past year that there's a lot of jobs that we didn't think could be done remotely that are being done remotely. And so it is exciting to see that the door is going to be open to a lot of new opportunities for different communities who haven't had those opportunities. And and really there's simply no geographic, barrier short of if we fail to bring broadband service to those people who need it. And so it is very interesting, the changes that we're likely going to see. And so I think that's kind of where we're getting close to our time here. I think we've got about 5 or 6 minutes. And so I wanted to give you all the opportunity, and Dr. Ali, you kind of talked about it a little bit, but what excites you the most about greater access, adoption, and use of broadband in general, and in particular with telehealth?
I think, broadband is the great equalizer, but broadband itself also has to be equal, right? We have to make sure that we are all connected. We all require high performance broadband. We can't just be satisfied with good enough broadband, right? And like Sarah said, like Barbara said, like Chris said, this is a game changer. This is a game changer for education, for health, for economic development, for keeping young people in rural communities. We know that, when a company decides to relocate, one of the first things it looks for is there a high speed connection for us to use? But we also need to remember, going back to our first conversation about an hour ago about the importance of digital inclusion, just putting wires in the ground means nothing if we don't equip everybody with the tools to harness it. And that also includes affordability, right? If you're paying $200 a month for broadband, how is that actually broadband? That's, we pay the most out of any developed country for our network connections. And quite frankly, they're not great, a lot of them. So I'm excited about the potential for equalization for broadband equity and what that can bring. I'm particularly excited about the idea of young people, maybe not always flocking to cities, but staying in rural communities or moving to rural communities. I think there's so much potential here, but we need to make sure that we are not just talking about wires in the ground, but really that whole digital inclusion package is going to be so important in the next year.
And I echo that. When I think about what excites me the most, it is the potential. It's the potential for our citizens of the state to do what we want to do when it comes to our education and our work and our, and our recreation. Having that broadband affordability and access and adoption. It sounds like a simple concept, but it's not. I've learned it's all interconnected and it's extremely complicated. We want to be able to leverage those technologies for our communities, whether it's a small town in the UP or Kalamazoo or the Thumb. It would be such a great accomplishment to level the technological playing field, so that everyone who wants to be on the team can be on the team, because it's going to be a team effort.
Agreed with Sarah and Dr. Ali. Well said on both of your parts. For me, I think in the last hour here, we've definitely disclosed all the challenges that are behind this. And as a broadband provider, I personally feel these challenges. And the excitement for me is to work through all of this and get to an end result that we can have broadband for everybody at a comfortable rate. It's a big deal, and getting through to the end of it is fun. So
yeah, the future of healthcare is in the digital health space. And we're going to see more needs. The Apple Watch and other wearables are changing how we look at health and how we manage our own health. And in the United States, we need it more than ever to deal with a number of our issues. So, the infrastructure for this, like rail and roads and airports and all of that, is essential to not only our modern health and our livability, but also to our, economic future.
Well, I want to thank each of you for taking the time. I know our audience has from based on questions and comments, certainly enjoyed this. I know that, again, we had a kind of a diverse group of folks talking about connectivity and broadband as it pertains to not only telehealth. We hit on all kinds of topics today, all of which are important. And I think it was summed up in that, that you don't fix one problem without helping and fixing the others, right? And so recognizing that we're all in this together, that there are these collective and unified needs each with our own purposes, is so important to our success in the future with this.